I would like to call upon Dr. Jayita Deodhar, who is the Associate Professor and Head of Psychiatry, Tata Memorial Hospital. She also coordinated the field work experiences of our batch that's graduating today.
Thank you very much, respected dignitaries, ladies and gentlemen and friends, and of course the stars for today, our students. Bruce Lee once said, "Don't pray for an easy life, pray for the strength to endure a difficult life." And I'm sure if you knew that statement, you would have known कि हर दिन टाटा मेमोरियल हॉस्पिटल में हमने ऐसे ही प्रे की, मतलब आपने भी और हमने भी, क्योंकि placement, it was a 8-week placement and it wasn't easy, it was tough. And people are, as you have rules in the university, and so did we have a lot of rules in Tata Memorial Hospital. So it was quite strenuous, it was quite hard work. People wanted to run away at certain times for certain reasons and they were not allowed to. So it's Center for Lifelong Learning, so it is, student days. So a lot of hard work has gone in by the students for this course, through their placements in the ward, through their placements in the OPD, and not just in the hospital staff. It is all the NGOs who are associated with the hospital, and and of course we had. I'm just telling you what we did. It was not just the placement. So every 3 days we had a meeting for supervision, for going through what they have learned in those 3 days. And because I believed it's not just book learning and practical skills learning, it's knowledge, skills and development. But along with development, there has to be some amount of self-development and personal development. So it's all about sort of managing, talking in front of groups, giving reports. So what you did with WhatsApp, I did with words. So we believe in all that. And thank you, because thank you for giving us the opportunity, and we took up our responsibility, and we being very serious people, we took it very seriously. I know I make a lot of jokes, but I really am a very serious person. But thank you again for being with us. We learned a lot from all of you as you learned from us. And to help in this part, I would be remiss if I don't mention a few people. And of course, our directors are always there in faith and spirit. But one particular director, Dr. Anil De Cruz, Director, Tata Memorial Hospital, who set the path and who put the responsibility on my shoulder to coordinate this. And we are very proud to say that at Tata we are really a family. So some of our family is sitting on the dais there. Thank you so much. Some of our family is out here. So with the help of that big family, which included medical superintendent, nursing superintendent, especially I need to mention her because it was she who took a lot of trouble for talking to the sisters in charges in the hospital to take them through the ward placements. All our DMG conveners, we have separate site-specific disease management groups conveners who facilitated placement in the wards. Our medical social work department, our rehabilitation services, and I told you, not just Tata Hospital, but all the NGOs who work in close collaboration with Tatas. So Mrs. Vandana Gupta, We Care, Preeti from Can Kids, Mr. Ganpati from JASCAP. So it's all possible because we all work in a family, and we all have that passion and we want to do it. So doing something voluntarily is something, but doing something with proper sort of scientific background, as you said, Professor Nasreen, so that is very important. And being the first is always good shoulder, a lot of responsibility to shoulder. And of course, I have troubled Dr. Sunita Sharma. But now that you are seeing me here, I am actually not the face. The face is Mrs. Savita Goswami, who has micromanaged every bit. I have been the helicopter view, she has been the cell and the tissue view. So without her, but again, as I said, we work as a family and we can work this same way and we walk the same path, because ultimately it's caregiving. So we are all caregivers and we all have one concern, is our patient. And I've always told you it's a system. So patient comes with the caregiver. So it's not just the patient, it's always the caregiver, and we are the overall thing. And I've always told you that this is what is professional caregiving. So caregiving can be something, and if this is professional caregiving, and today you're going to get the certificate for that, and we are very proud to have been involved with your training, and we are sure that you will do us all so much of pride by having done this and taking your future, and wishing you all the best in all your future endeavors. Thank you so much. Thank you.